Hello, everybody. It's a pleasure to be here with you, and we will present a case report regarding a complete removable denture constructed with a piezographic impression with light silicon. This is a presentation made by the framework of the NASRI project, and this is a case report which has been developed in during this project. The lack of stability and retention is one of the main disadvantages of total removable dentures, especially in the lower jaw, which has a higher resorption of the residual ridge. In order to achieve better results in this regard, the third impression procedure has been introduced in the construction of total removable dentures. This is a case report of a 70-year-old male edentulous patient who presented in the University Dental Clinic, who had all two loose dentures, and the main complaint was the lack of stability, lack of retention, and the low aesthetic. He had worn the dentures for 7 years, and after careful examination of the current dentures and the oral cavity conditions, where a high resorption of mandibular residual ridge was present. The following treatment plan was decided, so it is the construction of new dentures by using the piezographic impression. The material which was used in order to obtain this was the light silicon. The first impression were made with stock tray with alginate. Individual trays were constructed with photopolymerizing resin. The final impression was taken with zinc oxide eugenol, and the master cast was obtained, over which the occlusal and base rims were constructed. It was done a phase bow record, and the centric occlusion record was made. The casts were mounted on the articulator and the teeth setup was done. While in the train stage, the piezographic impression was registered with the material of light silicon. The piezographic impression was registered during functional and phonetic movements, and this registration were stored with pattern of silicon in order to register the piezographic impression. Then, after these procedures, the flasking and polymerizing procedure were realized, and based on the traditional cycle, the dentures were clinically evaluated, and regarding the stability and the retention of the new dentures, and also the patient's satisfaction was evaluated after 1 week, 2 weeks, 1 month, and 6 months, and also after 1 year after denture insertion. The patient was highly satisfied in all parameters based on the questionnaire, which is related to the oral health in This is a case where the benefits and the advantages of the piezographic impression are highlighted, and they can be explained in a very simple and effective way. Also, it's important to know that this presentation is part of the project The Evaluation of Total Removable Dentures Constructed Using the Third Impression versus a Conventional Technique, funded by the National Agency for Scientific Research and Innovation, with the Board of Administration Decision Number 6, dated 10 June 2024, number of Protocol 936/1. You can see here also the neutral space of prosthetic equilibrium, and this is the space where the forces applied by the tongue are applied and are counteracted by the forces by the cheek and lips. So, in this space, if the denture fulfills this area, then the muscles will tend to increase the retention of the denture and not to dislodge it. In this case, this is the area where the artificial teeth should be arranged, so the forces are equalized. Also, it is the same in the lower denture, and it is more important, especially in the lower dentures compared to the upper dentures. So, exactly, the forces applied by the tongue are neutralized with the forces applied by the lip and by the cheek. This space should be fulfilled by the base of the denture and by the artificial teeth. In this way, we have a registration of the position where the artificial teeth should be done, and also a registration of the area where the periprosthetic musculature leave their repression during the functional and phonetic exercises. So you can see here, this is a cross-sectional view, and you can see the position of the artificial dentures of the artificial teeth. If the teeth are arranged in this area, we have a balance of the forces which are applied outside and inside direction. Also, based on the physics laws, here we have the capillarity surface tension between a small surface between the oral mucosa and the dentures. So it is filled by the saliva fluid, which increases further the retention and stability. Also, it is important to understand the mechanism of the retention and stability of the denture. You can see here another case of a piezographic impression, and it is constructed the base-occlusal rims with there are the grooves which are made. First of all, it is positioned the upper occlusal base rims, and then it is positioned the lower one. First, it is registered one posterior area, and the other posterior area, and the excessive part are cut with the scalpel. And here you can see the piezographic impression registered already. The pattern of silicones, which store the piezographic impression. And here it is that they remove it, the piezographic impression, the UFGLP. It is fulfilled with red wax, and here it's the position of the artificial. Here you can see during the trying stage, where we check the occlusion, the centric, relation, and phonetic, and here there are also different other cases of piezographic impression. Here it's a case with lye silicone, and also here there are cases with wax, care wax denture.